Hello, everyone. This is Teresa Cross, PEBS Wellness Manager. Welcome to the webinar on your Employee Assistance Program, Cascade Centers. I just want to share a few housekeeping details before I turn it over to our presenter. Most of you are probably familiar with these already, but you will see that you have an arrow next to the control panel that lets you open and close it. To join the audio, you can choose to listen through your computer speakers, or you can choose the phone call and dial in using the information provided. If you have any questions, please type those into the question box. Caitlin, the presenter, and I will both be monitoring those. And I'm going to turn this over to Caitlin Plato now.
All right, thank you. Okay, so I am going to put on my camera here. I know that the bottom of my screen is covering those words. That will go away in a moment. But we're all just kind of getting this set up. There we go. Hello. Okay, let me move that over here so I'm not staring at myself the whole time. Okay, there we go. Now we can not have that bottom screen in the way. Okay, so everyone should hopefully be able to hear me, be able to see me. And what I wanted to do, we have an hour today. We have 100 people so far signed up for this in attendance that are here now. So welcome. I know everyone's rushing around and we all have very busy schedules. So if you're just joining, welcome. And what I want to do is kind of spend the first half going over the EAP benefits and a little bit more information about them. And then the second half, we have plenty of time to, answer Q&A. Again, with over 100 people, I hopefully can get to all the questions that come through. If for any reason I don't get to your question or you had further questions or follow-up questions after today, you can always call our main 800 number and they can connect you either to your specific account manager or to the person that could best assist you with the question specific to what you're looking for. And all of our contact information is at the bottom of every one of these slides and at the end of the slide deck. So with that, let's see. So someone's saying they can't get audio. Let me look here. I'm not sure. This is always my my first test. Let's see. If you can hear me, message in that you can hear me. Oops. Okay, wonderful. All right. Okay, if you haven't messaged me yet, don't worry, enough of you have messaged that you can hear me. This is promising. So I am not sure. Oh, okay, so someone's saying that they couldn't hear during the computer, but if they called in, then they could hear. So that might work, but I know that a lot of people are saying they can hear fine. So if there's something specific on your end related to not being able to hear my audio, perhaps you could switch to calling in and listening. But it looks like a number of people can hear. So hopefully if you call in, that might be a good solution, but that's my initial sort of testing it out to see what's all happening. And then someone said they had to switch their audio port. Or you may have to enable microphone in the settings. So if you're not sure, if you're not as tech savvy, maybe just calling in. On the dashboard on your side, there should be like a drop-down section that says audio, where you might be able to switch to like how you're listening. So if calling in is easier, then there you go. Okay. And then someone said they had to navigate to the orange flower button in the desktop bar and click OK for their sound. So everyone hopefully has found a way that works best for you. So I'm going to proceed forward and hopefully everyone has found a way that they can hear me all right, and we will go from there. So with the EAP, again, the first thing that employees understandably tend to always ask when they call in is this going to cost me anything? And is this confidential or not? So will my employer ever find out that I contacted you, and what capacity will they find out? And what we always like to make sure everyone knows is that this is a fully confidential service. Your employer would not know that you called us, because we want to reduce any possible barriers to people accessing EAP services. The other thing is that it is absolutely a free service. So for me, it's a pretty easy sell because this is free to employees and their dependents. So what I want to do is kind of get into more of the specifics, what qualifies as a dependent, and then what are the different services we provide. Okay, so if we're thinking about who's eligible for services, always a good starting point if we're thinking, how does EAP help me? So of course, all employees. One question that comes up too is if I'm an employee, but I'm not on my employer's medical insurance, do I still have access to the EAP services? And the answer is yes, because a lot of people might not be on their employer's medical insurance for a number of reasons, but that certainly does not exclude you from the EAP services. So that's still accessible to you regardless of where you get your medical insurance from. And then also as dependents. So dependents would be a spouse or partner, and then also children up to age 26, so up until they turn 26. And one thing that we like to remind people of, because this is another question we get a lot, is if the dependent is looking for individual services for themselves and they are 18 or older, they do need to call us directly or contact us, whether it's text, chat, email, calling, because of confidentiality. And so if they are an adult, they do need to call us directly or contact us directly to seek out those services. That follow-up question usually is, what will they have to say? So the only thing that we would need to get from them is, where does the employee work? What's their name? What's their job title? And this is actually usually the main sticking point for people is what's their birthday? And so they will need to know the birthday of the employee. But those are the only things. There's not some special ID number. There's, nothing else that dependent would need to know if they contacted us for services. So we try to make sure just up front to eliminate any uncertainty about how that call is going to go, especially if it's not an employee, which is understandably, what are they going to be asked? So that's really all we would ask them. And I'm keeping an eye on the questions box over here. So if you're noticing me like, shifty-eyed to the corner, that's because I want to make sure that I'm not ignoring anyone if they do have a question. So just type that in. We'll have plenty of time at the end, but if something comes up or something wasn't clear, just type that into those question box there. Okay. And then I'd mentioned this a little bit already, but there's a lot of different ways to access EAP services. This has always been the case, but I think it's important to especially make note of it now when we are in social isolation, we are in a global pandemic, and for some people it can be difficult. They maybe are now working from home, or if they're living with other people and more socially isolated, they will sometimes say, how do I call the EAP to set up services, or have, I see a question coming in, I'm not ignoring you. I'll answer that in 1 second. So there's lots of different ways to access services that are confidential. So if it's hard for you to make a call for confidentiality in terms of just the space that you're in, or if you're an essential worker, it's like, where could I go to make that call during the day? You can text in, you can live chat, you can email us. So we want to make sure that it feels as accessible as possible. And then there's also that 24/7 counseling. So even though our main number, if you're wanting to set up, other types of services, which I'll talk about here in a moment, things like scheduled counseling appointments, legal consultations, etc., that's that, regular business hours you would call. But that same 800 number down there is also 24/7 if you need to speak to a counselor immediately, and there's no limit to that. All right, let me look at a question that just came through. Oh, great question. So this is asking about an adult child dependent. Do they have to reside in your home? No. And that actually brings me to another thought, as that question kind of made me think of this. And this comes up a lot, that someone will say, okay, well, I have a 24-year-old child who qualifies as a dependent because they're younger than 26, but they're going to college on the East Coast, and how does that work? Or they're not living even in the same state as me. The EAP, we provide services to people nationwide and actually worldwide. So if a dependent is, under 26, it doesn't matter where they're living, they still qualify. And we can find providers and connect them to services wherever they are geographically. But I really appreciate that question because that does come up sometimes. Okay. And one of the many things I will say that sets us apart as well is that we really want to streamline accessibility to our services. And what that means is that we try to make sure that callers or people contacting us are getting connected as quickly as possible, because I know for a lot of people, having to re-explain what we're looking for or kind of bounce around to different people or get transferred around can be stressful, or especially if it's mental health related, it can be really hard to tell our story, explain why we're calling. And so we want to make sure that that's as quick of a process as possible. And so counselors answer the phone. That makes it a more streamlined process. That means that the person answering the phone can immediately sort of assess what's best for that individual in terms of suggestions for counseling or maybe other services we have. So that's a big piece of what we do that really stands out. And that's where we want to just really, as quickly as possible, get people connected to what they're looking for. So this is an overall summary of all of our services. I'm going to go over them in more detail on different slides. So if I go quickly over this slide, it's not because I'm skipping all of that information, but the slides as we move forward will go into more detail about these. But the main thing that I wanted to clarify on this slide specifically is that 3 counseling sessions. And as I'd mentioned earlier, that 24/7 crisis counseling line or 24/7 to talk to a counselor, that's separate and that's unlimited. So if anyone, you or dependent picks up the phone and wants to talk to someone right away, there's an unlimited amount of times a person can do that. The 3 sessions is if you, or a dependent, depending on who's using the sessions, wants to schedule with the counselor, and all of our counselors are licensed, where it's the same counselor each time. So getting established with a specific counselor, and all 3 sessions are with that same counselor. So that's really the difference there. Right now, we're providing telehealth counseling. So that would be video, phone, or text options, just because of everyone's safety during these crazy times. But those are all still licensed counselors, and it's just as, a quick turnaround time to get scheduled. None of that has changed. So that is something I just wanted to clarify, like how many sessions, and that's per year, so per calendar year, and those renew every year. So that's the, let's see here. It looks like sometimes there may be like a different amount for different departments, but you can always double check based on department specifically. And so if you're ever curious about like your specific set of sessions or your specific department set of sessions, you can always call us, text us, or email us to confirm that. And there was a question, I definitely will get into what types of counseling are covered. I like all these questions because you're jumping ahead to what we will get to soon. So I'm glad that at least the slides will answer pretty much all of these. But one question that did come up is asking what topics may an emergency caller discuss. So even though it's considered crisis counseling, I'm just going to jump to the next slide here. So for the 24/7 line, that can be about anything. So oftentimes, when it's listed as like a crisis line, we do want to make sure that people know they can still use that 24/7 line, even if they're not identifying as being currently in a crisis. We've had people call that 24/7 line and just say, I need to vent about the fact that I'm burnt out with work, and they may not identify that they're in a crisis, but they just want to talk right away. So it can really be about anything. Yeah, so the per incident, someone's asking about that. Really what that means is that it's 3 sessions total. It's not set up as 3 per person. So if someone in, a family unit or who within the group of who qualifies to use services, say an individual is using sessions, it's not set up that multiple people can be simultaneously using their own set. So it is 3 total. But the reason the per incident is in place is that if someone, say, used 3 sessions for something that was going on in their life, maybe they were struggling with some anxiety symptoms, and then later on within that same calendar year, something else came up, either with that same person or a different family member that was a new and unexpected occurrence. So that could be something like a traumatic incident, someone lost their job, there was a death, something that was unexpected that happened. They can call and say, this recently happened and I'm wanting to get 3 sessions for this incident, and we can get them connected to services. And for counseling, the EAP sessions, you can use those for couples, family, or individual counseling. And this list here that you're looking at is not an exhaustive list. These are just some examples. And so really there's no kind of limit to what a person can talk to a counselor about. The main thing that I wanted to mention just on this slide is that the substance use, alcohol, drug use, addiction counseling, we do have mental health counselors who have experience working with people struggling with addiction, but that's not the same as drug and alcohol treatment. So drug and alcohol treatment would be something like inpatient, detox, intensive outpatient, outpatient. Those are things that would be covered by medical insurance. But if someone's calling us and saying they're looking for actual drug and alcohol treatment, we can right then on the phone find a list of local treatment options near them, help them get connected to what's around. And that's why having counselors answer the phone is helpful, because we may be able to, in that process, help narrow down what level of treatment is likely going to be best based on what they're telling us, and then narrow down that list of resources. So they have a starting point of who to connect to, who to talk to, but that would be covered through medical insurance. So that's sometimes people have questions about that specifically. So just wanted to kind of clarify that piece. And I'd mentioned this already a little bit with the telehealth. So that is, of course, what we're all doing. We're doing it right now too. Everything's Zoom or GoToWebinar. So just as a reminder, all the telehealth services, of course, are HIPAA compliant. And there's lots of options of how people utilize telehealth. Some really prefer a phone session, some video session. So we want to make sure that we meet people where they're at and what works best for them. All right, so we're moving a little bit into the non-counseling benefits. A lot of times when we do orientations, and it feels like forever ago now that I was doing them in person, but sometimes when I was physically in a group of people talking about this, we'd get to this point of the presentation and people would be like, oh, I forgot that you did other things besides just counseling. So we like to really make sure that people know all the things we offer. And one thing that's coming up for a lot of people right now, and maybe many of you also are experiencing this, is it's global pandemic. We're moving into the fall. There's childcare stressors, there's homeschooling stressors, there's so many things, elder care, the list goes on really. And one of the benefits we provide is what's called resource retrievals. And so if someone is calling in and saying, I need to try to find childcare for, say, my 2-year-old, and these are the hours I'm looking for and the days I'm looking for, I don't know where to start, we can do that research. And in 3 to 5 business days, email or call based on their preference what we've found in terms of resources for them, because people are stressed and or they don't have time to look into resources, and we can help with that. It doesn't have to be just about childcare or elder care. It can really be about anything, and we can do the research for you. There's also the legal consultations, and those are 3 per calendar year, and each consultation is a free 30-minute over the phone consult with an attorney. And within each calendar year, those 3 consults do have to be about 3 separate legal issues. But what's really great is that if someone does that free consult and they want to then retain the services of the attorney, that is at a 25% discount. And so if you wanted to set up services, whether it's counseling or anything else I talk about today, it all goes through that same 800 number, which makes it a lot easier too. And then we have the Will Kit questionnaire. This is for people who are thinking that they will likely have a fairly simple will. Maybe it's an individual and kind of just a fairly straightforward process. This paperwork, you can email us or call us and we can send you all the documentation. It's really an initial questionnaire that you would fill out, and then all the instructions are in the paperwork. That would get sent to our legal department. They would look it over and then contact you and say, you know, here would be the next steps if you wanted to finalize a will and help with that process. But that initial kind of questionnaire paperwork to get that process started is completely free. And for a lot of people, it's helpful if they've never done a will before or don't really know the process. It can help them even think, what types of questions do they ask? Maybe as I'm going through this simple one, I realize mine might be more complicated, but I have access to a free legal consult if I wanted to talk to an attorney about maybe a more, you know, complex will that I want to get set up. And so that's a really great tool that people have used many times. Okay. So someone joined a little bit late. Yeah, so dependents would be, so just really quickly, so dependents for EAP is spouse or partner and children up to age 26. And there's no fee for employees or dependents. Anyone who qualifies for EAP services, it's a free service to them. And because it is confidential, yeah, if the dependent is an adult, they do need to call us and set up services themselves. All right. And this isn't, you know, maybe the first thing on people's mind right now, but it will be, as we all know, every year. So there are options with help with tax prep services, and it's a free consultation if you have basic tax questions. Again, call our main number to access all of those services. And then if you wanted help with a personal income tax return at a discounted rate, that rate would be discussed with the legal department when you called in, and they would give you options of what that would look like based on your tax return and what you're looking for. I would say, yeah, it looks like there was a question about the will kit. Yeah, so you can, if it was going to be a more complicated will, then you would have access to work with that attorney at the discounted rate to set that up. And the tax services are always available. So if you want to look ahead into the future and be prepared, you can that's a good question. You can always call and talk to someone about tax questions. It's not only just during a certain window of time. Good question. Yep, we have slides for all of our benefits. So all good question. And the contact info for the will kit is the exact same contact info for everything else, that the same number that you would call for anything else. We also have ID theft services. So this is very similar. You would call, and I'll say this on every slide, you'd call the same number down at the bottom to set up any of these services. And then if people have questions about either ID theft, maybe a person's already a victim of ID theft, or someone's looking into what are some ways to preventative strategies, you have access to talk to someone about that. There's also a lot on our member site that's just automatically downloadable information on like how to prevent it as best as possible, other tips. Yeah, everyone should have access to the slide deck, but I'll make sure that the co-organizers get a PDF of this slide deck that everyone will have access to. And on the legal services, yeah, exactly. So they're going to connect you to an attorney within your state, which goes back to there may be an employee or dependent, you know, who's maybe out of state, and that legal department can get them set up with someone who is within their actual state. So with the financial coaching, these are just a few things that people often will call in about when it relates to seeking financial coaching. What the benefit is for this is 30 consecutive days from the day that someone signs up for it. So if you called in today and signed up for financial coaching, you would have 30 days starting today to talk to that financial coach over the phone as often as you needed. So you just have access to them as a financial coach for that 30-day window. After the 30 days ended, if it was within that same calendar year, You could continue to use their services at $40 a month, but you have access to the free 30 days of financial coaching every calendar year. And that's per family as a total. So that's one sort of difference there. And then that's going to be a financial coach, so they can work with you on retirement planning, you know, saving for a home, dealing with, you know, if you're trying to reduce debt or plan around budgeting. So all different types of strategies. And if you had, you know, more really specific questions based on your specific financial situation, call us and we can have you talk to that financial department who can really get you connected with someone that would be a good fit for your needs. And how much per month again with the financial coaching? That's $40 a month after the free month. Okay. And we also have the home ownership program. So this is if someone's looking to sell into selling, buying, or refinancing. It's a really wonderful benefit. Sometimes what will happen is employees will realize, kind of forget we have this benefit and be like, oh, my adult child who qualifies as a dependent was looking into buying their first home. So sometimes a reminder, again, it doesn't matter where they live. If they qualify, you know, please call us. We can get you connected to that department right away. And it has helped people with inspection costs, and that's saved people sometimes thousands of dollars. It really helps with de-stressing because you have sort of a team there to help you through the process, explain things, work with you on, you know, what's going to make it as smooth as a possible process. So if you have more questions about that or how that would relate to your specific scenario, again, call us and we can immediately connect you to them. And then life coaching is a slightly newer benefit that we've had. Oftentimes I get asked, or we get asked, how is life coaching different than counseling? And that's a really good question. So with counseling or mental health counseling, that is oftentimes, if, you know, certainly would be in the category of if someone was like looking for couples or family, or for individual counseling, maybe if someone's struggling with anxiety, depression, PTSD, some type of mental health concern that's impacting their life in some way. The life coaching is really more about that there isn't a mental health concern. It's more about maybe a life adjustment or a life skill that someone's looking to improve. So this may be, you know, I really want to work with someone on my assertiveness skills in meetings, or I want to advance my career, but what are some things I could do, you know, kind of some life skills, some strategies to help with that. So this is really kind of how those differentiate. The life coaching is 3 total sessions available per calendar year, and those are just over the phone. So those are phone sessions, but this would always be with the same life coach. So similar to counseling, when you set up life coaching, you would be assigned a specific person, and that's who you would have for all 3 sessions. And there are questions about like specific services, maybe related to certain diagnoses such as autism. If you're ever looking for specialized services or specialized counselors, call us so we can narrow down counselors by specialty, look into options. And so we're always happy to try to assist you and find you the right type of services and the right type of clinician. And a lot of the next few slides, you'll find almost all of these resources immediately accessible through the member website. So with pet parent resources, and I'll talk about gym membership discounts here in a moment, all of that is really the quickest way to access all those things is through our member site, which I'll talk about here in a moment. The life coaching is free for the entire family. Yep. And so with the pet parent resources, there's access to discounts on pet insurance and different resources directly through that member site. I'll give you kind of a screenshot of what that looks like here. And I know with gym membership discounts, we may not be sort of in the mentality of going to the gym right now. We might be having our, you know, home gyms for now. But just as a reminder that there are lots of different ways to access discounts as an EAP member and gym memberships is one of them. So with the member site, as promised, here's kind of a small or a screenshot of kind of what that site looks like. Oftentimes what I hear is that people will go to just our regular site, cascadecenters.com, and not realize they can actually log in as a member. So if you go to cascadecenters.com, you'll see a button that says member login. And at that point, it's going to ask you very simple questions. Create a username, what's your email, create a password, and it will ask you the name of your company. With State of Oregon, that's just going to be State of Oregon, not the specific department, just State of Oregon. And then it will take you to the member site that looks just like what you're seeing here on the screen. And these are just some of the tiles, not all of them. But as you can see, you can find access to what benefits do I have. Maybe there's archived webinars. There might be free legal documents that are downloadable, videos, articles. There's tons of stuff on this site. And you can also live chat with a counselor through the site. So I always encourage people to log in if you haven't already and really just kind of look over how that site works so you're comfortable with it, because it's a really great way of accessing all of our services and knowing what you have. We also started fairly recently the WholeLife Directions program. You can do it through the app. You also can go to WholeLifeDirections.com and do it directly through a computer. So Cascade has created a evidence-based self-assessment tool, and it takes approximately 5 minutes to go through the questionnaire. Again, this is completely confidential. Your employer would not know that you downloaded the app. They wouldn't know that you took the quiz. And it's going to assess you on different levels of different topics. So you can see here on the right-hand side, things like depression, sleep, those types of things. And it may say you've rated high in depression, sleep, moderate on PTSD, low on anger, those types of things. And so it will assess you on different levels of how you answered those questions. Then it will take you to the option of going through modules of evidence-based interventions. So for many people, this is a really helpful tool if they like kind of more self-paced, at their own time, that they want to maybe learn some skills. There's mindfulness activities, there's CBT interventions. And again, this is a confidential, it's literally right at your fingertips. It is an evidence-based assessment, and the interventions are as well. So this is more kind of, how do I learn more about some skills to improve? Other times people may say, I took this assessment and it said I rated high on depression. I'm going to call the EAP and schedule, some sessions with a counselor. And maybe I do, want to work on this more, or kind of talk about how this is impacting my life. And this is free. So when you go on and you log in, it will ask you for an access code. You can either type in State of Oregon or PEB. Either of those work as your access code. I saw a quick question come in. So there's a question asked about calculating long-term and short-term disability coverage. Those questions are typically not within the parameters of what EAP can answer in terms of understanding disability. I would usually direct people to talk to HR if they have questions about that. But as always, if you are not sure, or if there's ways that we might be able to assist you, call us and give us more detailed kind of specific info about what you're looking for. And we can find out, here's what we definitely can help you with. Here's what might be a good resource with something, not through us, but someone else. So we will still always make sure to give you lots of options of what we can do and what might be the best next steps for you. So if you have more detailed questions about that, definitely contact the EAP and check in about that. Okay, so as promised, the first half was really going over all of the benefits. I'm going to expand out my questions box here because I think that will help me read this a little bit better. Because we are in the questions and answer section, to free you from me leaning forward into the camera to read the tiny print, I am going to turn off my camera. So my camera is being turned off. It doesn't mean that that happened, it happened on purpose. Okay, let me make sure that my screen There we go. Okay, I jumped to that slide. Let me go back here. All right, so you have all of our contact info. Okay. All right. Okay, I think I answered that one. Let's see, I'm still looking through, see if there's any others. Okay. So there's one asking about limit to the number of different EAP services an employee can access in a year. So your EAP benefit as a whole renews each calendar year. And then if there are certain benefits, let me actually just jump here real quick because sometimes the bottom of my screen gets covered. There we go. So the renewal of your benefits is always the calendar year, but it depends on the type of benefit of how that looks. So the counseling versus financial coaching versus legal, because as I was sort of going through all those slides, they may look different in terms of what that benefit looks like per calendar year. So if you have questions about one specifically, definitely let me know. Someone asked about if there's culturally specific counselors and services available. Absolutely, we can narrow that down. We have a number of ways we can narrow down counselors. Ethnicity, we can narrow down by specific language that they speak, and culturally competent counselors, we can narrow down by anything that someone's looking for. If you go onto cascadecenters.com, someone's asking about how to log into the site. About halfway down the page, there should be a dark blue kind of button that says member login. And you do also have access to just our regular Cascade Centers app. So if you just search Cascade Centers EAP, we have an app as well. Let's see here. So if your computer service has been hacked, these are the types of things that you could call us and ask for a resource retrieval. So if you're looking for how do I find an option of how to handle a computer that's been hacked, we can look into research for you of are there, you know, organizations that help with people with that. So that could fall under a resource retrieval. There's really nothing I can think of that you couldn't call us and we can at least try to find you some resources related to it, or it would likely fall under one of your actual EAP benefits. If people are looking, again, similar question, someone's asking another thing that would fall under resources. If someone's looking for transitional housing, immediate shelters, anything like that, call and we can help them find resources. So that would, again, be another resource retrieval. And the homeownership program, so that is that you would contact the program and get connected with them directly. It's different than the 3 times for free, so that would be once per year. And I unfortunately don't have a ballpark cost of a simple will because it's so specific to each person. So I don't want to throw out a number and have it be different than what the legal department would tell you, but that always is going to be something that they can go over with you when they get more details. The benefits renew each calendar year. So yep, January 1 of every year. Yeah, we do have specialty counselors who have a specialty in working with individuals in immediate responder, law enforcement. We really have a lot of ways of narrowing down counselor specialties. And you can ask for a counselor based on gender, all sorts of things. So yes, if you would prefer to speak to a female counselor, we can find someone who can help you with, or that is a counselor available. Okay. So with the gym membership discount, one thing that I am aware of is I think it works for if someone's wanting to start a gym from scratch. So if you're already a member of a gym, I think the discount wouldn't work just because it's a discounted rate of the joining fee. So the financial coaching services is available to someone for 30 consecutive days. So you can speak to that financial coach as often as you'd like within 30 days. Counseling sessions are not recorded. That's a good question. So everything's HIPAA compliant. You're not being recorded. I'm not familiar with Canary Health, so I would guess that's separate than Cascade Services. All good questions. And again, you will have access to, here, let me make sure that you can see the bottom of the screen there. You will have access to a PDF of these slides. I'll make sure that you will I'll email those to the other presenters. Okay. And it looks like some other insurance companies that people might be on do also offer different membership, gym membership discounts and services. All right. So the questions about, let's see here. There was questions about pet resources. If you're logged in as a member, there should be a tile about pet resources. And then the counseling services, yeah, if someone wants to talk to a counselor about like career counseling or like deciding a college major, really they can work with a counselor about anything. If you needed assistance related to things with employee paid leave, that would be something we would encourage you to talk to your human resources about, because there may be very specific paperwork that was involved with paid leave that would go through your HR. But if you needed further resources about anything else related to that, or counseling services as well, that's where, you know, definitely give us a call and we can help with that. And the financial coaching, yep, we've had people call in and ask about financial coaching related to investment questions. And free counseling sessions are 50 minutes. So those would be the same as pretty much any standard counseling session. So that's how long those are. And we have a lot of COVID resources on our website. So we've added a ton of webinars. Cascade also has a YouTube page, and we have lots of archived webinars. I've done a series of short videos on coping with quarantine. So that's a good place to look if you're looking for resources, as well as the COVID page through our website. And we always offer, you know, webinars, training. So if an organization is looking for added support, then they can contact us. And yes, 50 minutes per counseling session. So if someone sets up their 3 counseling sessions, then each counseling session is 50 minutes long. And I can't speak to how much an attorney would charge after the free legal consult, because that will be so specific to what the legal concern is and what's necessary based on that. It would be at a 25% discount, but you would want to work with that attorney directly to get those types of fees and fee options answered for you. All right. These questions are coming in fast and furious, but I'm fine with it. Hopefully I've answered to the best of my ability all the ones that I can answer. And again, anything that doesn't get answered today, you can call us. Limited to specific attorneys. So there's tons of attorneys on our panel, but you would be connected to someone that was within our attorney panel. Yeah, you can talk to the homeownership department about the different discounts that would be applicable to you based on what you're looking for. And oftentimes that $2,000 to $6,000 savings is on reduced cost for inspection costs. I know that people have saved quite a bit on that. But again, for each specific average, there's a lot of ways that they can help with the buying, selling, or refinancing. So if it's one thing with the legal service is that if it's in any way related to employment or related to disability, that would be outside the scope of what our legal services provided. But we can still help with finding outside resources if someone wants options of who could help them if it was like an employment related legal question. And if you needed more than 3 counseling sessions, what we always do is when someone calls in, we will ask what their medical insurance is as well, because we want to assign someone to a counselor who's also on their medical insurance. So if you did want to continue beyond the 3 free sessions, you would then switch to insurance and you wouldn't have to change counselors. You could just keep that counselor and then use your medical insurance as well. And a lot of these are falling into what would also be that resource retrieval. And there's, if anyone has tax questions about pretty much anything, they can call us and we can get you connected to that department and they can get you connected to someone who can help. But relocation services, I would say there's really nothing that we can't help find resources about. And I know this is a lot of information and sometimes there's very specific questions. Some of these I hope I answered as best as possible. Some others, it may be helpful to call us individually. We can get a little bit more detail about what specifically you're looking for and your specific situation and have a more detailed conversation around what those options would look like. What I hope today provided was that, we can pretty much sort of be a service that can help you or your dependents with just about any area of their life. And it's free, it's confidential. So we just want to make sure that everyone knows we're here, knows how to access our services, and feels comfortable contacting us. All right. So let me see here. Our average response time to email inquiries, that's going to, would be the same day, if not the next day. And our web page, let me see. I think right now, because I do want to make sure that our closed captions remain, and if I go off this screen, we're not going to have our closed captions. But if you do have questions about our web page, I can actually send the link to everyone. So let me, I'll type in our actual let me make sure I have that typed in right. All right, so in the chat, I just typed in a link to our website. If you go there, you'll find, you can see at the top, there's resources specifically to COVID, like I'd mentioned. And then also, again, about halfway down, you'll see a little button, or it's not little, but a dark blue button that says member login. And that will take you to a separate tab. And that's where it will ask you to either register as a new user or to sign in with a username and password. Again, when it asks for your company name, you'll want to type in State of Oregon, not your actual specific department. And when you start typing in State of Oregon, you will see a drop down show up that says State of Oregon. You would just click on that drop down and that would autofill that. And that's how you would, and the rest of it's all just that you're making up your own username and password. So all of that's self-created by you. And then you'll be able to log into that site directly through there. But again, all very good questions. I know that there was over 100 of you today, and I hopefully answered as many as I could. So I'm going to turn it over to Teresa if you had anything else that you wanted to add. Then we can go from there.
Thank you, Caitlin. This was terrific. I was looking at the comments and the questions too, and there were several people who noted that the EAP resources benefit was so much more than they had thought it was. And so I'm thinking that we may want to do maybe an annual or twice annual orientation to the EAP. It really is a very good benefit. As Caitlin mentioned a few times, I will send a PDF of the slides out to everyone. There will also be a recording of the webinar, and that will get posted on the PEB website. If you can think of any other questions, or if questions come up after we log out here, please send those to me and I will work with Caitlin to get answers for you. I hope everyone has a really great day, and look for more information on the slides soon.